Hey everyone, welcome back. Today we're talking about a medicine that almost every household keeps, paracetamol. It's the pill we reach for when we have a headache, fever, or body pain. But have you ever wondered, is paracetamol really as safe as we think? Or could there be some hidden risks behind this common painkiller? Paracetamol is used by millions of people every single day. It's trusted, cheap, and easily available. But just because it's common doesn't always mean it's harmless. In this video, we'll explore 7 big effects of paracetamol, both the good and the bad, so you can understand how it really works inside your body. Make sure you stay with me till the end, because some of these effects might surprise you, and they could help you use this medicine more safely. So, what exactly is paracetamol? Also known as acetaminophen, it's a pain reliever and fever reducer that has been around for decades. It's found in popular brands like Panadol, Tylenol, and Calpol. Doctors often recommend it as the first choice for mild to moderate pain, such as headaches, toothaches, or muscle aches, and to bring down fever. Paracetamol works mainly in the brain, where it helps block certain chemicals that cause pain and raise body temperature. Unlike medicines such as ibuprofen or aspirin, it doesn't have strong anti-inflammatory action, meaning it doesn't reduce swelling or inflammation in the body. For a long time, paracetamol has been seen as one of the safest painkillers. But recent medical research, including studies published by Dove Medical Press, suggests we might need to look at it more carefully. New findings show that while paracetamol can be effective, it can also carry risks, especially when taken too often or in higher doses than recommended. Effect 1. Relief of pain and fever. The good. Let's start with the good part. Paracetamol truly works, and that's why it became the world's go-to painkiller. When you have a headache, fever, flu, or body ache, it helps reduce pain and brings your body temperature back to normal. It's gentle on the stomach and doesn't cause irritation like some other painkillers. That's why doctors often recommend it as the first choice for mild to moderate pain. According to the Medical Journal of Australia, there's moderate to strong proof that paracetamol can relieve certain types of pain, like fever, dental pain, and headaches. But here's something many people don't know. Studies, published on PubMed, show that in many other conditions, such as back pain or arthritis, its effect can be surprisingly small. Some people take it daily expecting full relief, but end up disappointed. So yes, paracetamol does help. It can calm pain and lower fever effectively in many situations. But it might not be the miracle pill we assume it is. And that's where we need to start asking, if it doesn't reduce inflammation, is it really enough for stronger pain? Effect 2. Minimal anti-inflammatory action. Here's something most people never realize. Paracetamol is not an anti-inflammatory drug. That means it doesn't actually reduce swelling or inflammation in the body. Medicines like ibuprofen or aspirin belong to a different class called NSAIDs, and they fight both pain and inflammation. Paracetamol, however, mainly works in the brain to reduce pain signals and fever, but it barely touches inflammation. Research published on PubMed Central confirms this. Paracetamol has almost no effect on inflamed tissues, which means for problems like joint swelling, sports injuries, or arthritis, it might not do much. You could take it and still feel pain later because the inflammation, the root cause, remains. This is an important point when choosing your painkiller. If your pain comes from inflammation, like in muscle injuries or arthritis, paracetamol alone may not be enough. It can mask the pain for a while, but it doesn't solve what's happening underneath. So while it seems safe and easy to use, knowing its limits helps you choose wisely, before you end up depending on something that isn't working as well as you think. Effect 3. Potential for liver damage and overdose, the big risk. Now here's the dark side, and it's serious. Paracetamol overdose is one of the leading causes of liver damage worldwide. Yes, this small pill, if taken in excess, can destroy your liver cells and even become life-threatening. According to data summarized on Wikipedia, thousands of hospital visits every year are due to paracetamol poisoning, often accidental. Here's how it happens. When you take paracetamol, your liver breaks it down safely. But if you take too much, the liver can't handle it. A toxic byproduct builds up, and it begins killing liver tissue. People who drink alcohol or already have liver disease are at much higher risk. The danger isn't only from large single doses. Even taking a little extra over a few days can be deadly. The symptoms often come late. Nausea, pain under the ribs, or yellowing eyes. By then, damage may already be done. So never cross the safe limit, which is usually no more than 4,000 milligrams per day for adults. Paracetamol can save you from pain, but misuse can cost you your liver. Effect 4. Hidden risks with long-term or high-dose use. Most people think paracetamol is perfectly safe if they don't overdose. But newer research tells a different story. Studies published on PubMed Central have shown that even regular or long-term use within the normal dose may carry hidden risks. For example, older adults who take paracetamol frequently are more likely to develop stomach bleeding, kidney problems, or even heart issues over time. The reason is simple. Constant use forces your body, especially your liver and kidneys, to process the drug daily. Over months, that stress can quietly build up. You might not feel anything at first, but damage can happen slowly. These risks grow even higher for those who combine paracetamol with alcohol or other medications. So, even if you're taking the right dose, taking it too often isn't harmless. It's meant for short-term relief, not daily use for months. Chronic use, especially in older adults, can be dangerous. Always talk to your doctor if you find yourself depending on paracetamol regularly. It's easy to underestimate the risks until it's too late. Effect 5. Risk of elevated blood pressure, cardiovascular effects. This one may shock many people. Some new studies, including research published in the European Heart Journal by OU academic, found that paracetamol might raise blood pressure in certain users, especially those with heart conditions. The exact cause isn't fully understood, but scientists believe paracetamol can affect how the body handles sodium and blood vessel pressure. For people who already have high blood pressure, taking paracetamol daily may push those numbers higher, increasing the risk of heart attack or stroke. The danger is subtle because the medicine feels harmless. You might take it daily for joint pain, not realizing it's putting silent pressure on your heart. Now, it's important to note, research is still ongoing and results are not 100% conclusive. But it's enough to make experts cautious. So if you have blood pressure issues or heart disease, paracetamol might not be as safe as once thought. Even your everyday painkiller could be quietly working against your heart. Effect 6. Reduced efficacy in some pain conditions. Here's a surprising fact. Paracetamol doesn't actually work well for some of the most common pain types. For instance, studies published in the Medical Journal of Australia showed that in conditions like lower back pain or osteoarthritis, the benefit is extremely small, sometimes no better than a placebo. People often take paracetamol expecting complete relief, but it may not do much for deep, long-lasting pain caused by inflammation or nerve damage. This doesn't mean it's useless. It still helps with mild pain and fever. But relying on it for everything can lead to frustration and overuse. This is one of the reasons experts now recommend being selective. If your pain is persistent or severe, paracetamol might not be the right tool. It's simple, safe for short-term use, but not a cure-all. So before you reach for another dose, it's worth asking, is it actually helping? Or just something you've gotten used to taking? Effect 7. Extra caution in special populations. Finally, let's talk about people who need to be extra careful. Pregnant women, older adults, and those with liver or kidney problems should use paracetamol only when absolutely necessary and under medical supervision. While it's often considered safe during pregnancy, new studies reviewed by The Guardian suggest caution. Even though most evidence shows no link between paracetamol and major developmental risks, experts still advise using the lowest effective dose for the shortest possible time. Older adults are another group at risk. Their liver and kidneys process drugs more slowly, so even normal doses can build up and cause harm over time. People who already have liver disease or drink alcohol regularly are also at higher risk. So if you fall into any of these categories, don't take paracetamol casually. Always consult your doctor first. What seems like a harmless tablet could behave very differently in your body compared to someone healthy. So, what's the truth about paracetamol? It works, but it's not perfect. It helps reduce pain and fever, and has earned its place as one of the most trusted medicines in the world. But at the same time, it carries real risks: liver damage, long-term side effects, and even hidden heart and blood pressure concerns. The key takeaway is simple. Use paracetamol wisely. Stick to the correct dose, don't mix it with alcohol, and avoid using it every day unless your doctor tells you to. Remember, it's meant for short-term relief, not as a permanent solution for pain. Paracetamol is not harmless, but when used properly, it can still be safe and effective. So be smart, protect your liver, and always read the label before you take it. If you found this information helpful, don't forget to like, share, and subscribe. And comment below if you've ever experienced side effects or strange reactions after taking paracetamol. Your story might help someone else stay safe.